Good evening, I'm Dan Wall.
And I'm Laura Lee. Thanks for joining us. A Northland reservation is the first tribal nation in the state and country to introduce a new and unique approach to health care. Public health vending machines.
From basic hygiene products to HIV test kits to Narcan, the goal is to provide access to basic healthcare needs to anyone, free of charge and free of stigma.
But there is also a more pressing issue that these machines hope to achieve: to save lives.
Inside the Fortune Bay Casino on the Bois Forte reservation in Tower, Minnesota, a new machine bringing people from all across the reservation.
An item in those machines will save someone's life.
Pam Hughes is talking about the new public health vending machines recently launched on the tribal land. The Bois Forte tribal member has spent the past 2 decades working with tribal leaders to secure grants to help with substance abuse and homeless prevention. The Bois Forte territory has 2 public health vending machines in its pilot program, one at Fortune Bay and the other at the C-Store in Nett Lake. And they are exactly what they sound like.
These public health vending machines provide everything from basic necessities to at-home testing kits, and they're all free of charge. For example, if you wanted a COVID test, all you would have to do is hit the PIN number 1234 pound, and then the item you need, which is 118.
The vending machines also include items like Narcan, which is an overdose reversing drug, to HIV and diabetes test kits, to basic hygiene items like socks, water, and snacks.
It will notify me at the C-Store a product, Narcan, was dispensed. Just to be able to see those machines and that they're being used is really, it's hard to describe that feeling that you get because it's a dream come true.
A dream that is also making history.
You know, we are the first tribal nation in the United States to have public health vending machines on tribal land, and to my knowledge, we are the first place in the state of Minnesota.
Hughes, who is a project research manager with the University of Minnesota Duluth College of Pharmacy, along with the Bois Forte Tribal Council and members from the Johns Hopkins University, helped to secure a $1 million grant to bring these machines to the Northland.
Right now, we have this overdose crisis nationally that is disproportionately affecting many Indigenous peoples. It varies by tribes, but here in Minnesota, we know that Ojibwe people are more likely to die by overdose than are other Minnesotans.
According to the Centers for Disease Control and Prevention, the Native American population had the highest drug overdose death rates in 2020 and 2021, with nearly 43 deaths per 100,000 people in 2020 and nearly 57 deaths per 100,000 people the following year. Dr. Melissa Walls is an Indigenous researcher with Johns Hopkins University. She has spent the past 20 years promoting health equity for Native American communities. The last 3 years researching substance abuse within the Bois Forte tribe.
Most people who are using substances don't want to die. And in today's drug market, fentanyl is really potentially everywhere. And so giving people the basic human right to life through a vending machine is really miraculous.
She says a Johns Hopkins colleague studied a similar pilot program in Nevada, which demonstrated success in driving down the number of fatal overdoses. Wall says by bringing this innovative movement to Minnesota, putting a public health vending machine without charge or stigma on reservations, and meeting people where they are, is critical to saving lives.
Now, one of the stigmas about harm reduction approaches is that if you give people access to life-saving products or maybe clean syringes for their injection drug use, that you're enabling the condition. And actually, the science tells us the very opposite is true. If you actually show compassion to people and meet them where they are, you can help them in their journey towards recovery.
A journey that 33-year-old Casey Chosa has endured and survived.
I've seen a lot of drug use. I've seen like people OD, people using needles. I've seen people using, dirty needles, needles that, been used so long that the numbers are getting rubbed off of them. Just in the last few years, I've lost 2 cousins. I've lost many friends to overdoses. So I think having Narcan easily accessible will save a lot of lives.
The mother of 5 is now 3 years sober, but her road to recovery included many nights wondering where she would sleep and when she would eat.
I know when I was homeless, like they have granola bars and stuff, like I was starving, you know, so I would have liked an option to go to a vending machine for free.
A message she hopes will reach those who need access to the life-saving healthcare kits without fear of shame or punishment.
I feel very proud to be a part of something like this.
And a personal message to her role model for never giving up on her.
I think that's so awesome that like she makes her, you know, life mission to help people.
My grandfather was the one that really wanted me to come here to Bois Forte, and one of his last wishes to me were to take care of the little ones, and that's always in the back of my mind. That's why I'm here. I'm here to help our people.
Now, the items in the machines also include women hygiene products like pregnancy tests, and they change seasonally to include hats and gloves in the winter and sunscreen and sunglasses in the summer. Hughes tells me many tribal communities have already expressed interest and have started conversations to hopefully bring public health vending machines to every reservation in Minnesota.